Earlier this week, the Prime Minister told us that we have to proceed cautiously on lifting lockdown. But nonetheless, nothing in the data that he'd seen suggested we need to interfere with the roadmap. Is there anything, Secretary of State, this morning that you know about, that you've seen, that would require delay, pause or modification?
Well, it's too early to make a final decision on that. As you've said, the Prime Minister and I and the team will be looking at all of the data over this week. We've said that we'll give people enough time ahead of the 21st of June date, when this is penciled in, the next step to be not before the 21st of June. And the critical thing is to see whether the 4 tests that we set have been met. And that's in terms of the number of cases, and cases are rising slightly. The number of hospitalisations, which are much more flat, and that's because the 3rd test, the rollout of the vaccine, which is going incredibly well. And then, of course, we've got to look at the impact of new variants, and we have seen a very significant impact of a new variant, the so-called Delta variant, over the last month or so.
Yes, in fact, that's the big unknown here, isn't it? What you call the Delta variant, which a lot of people still call the Indian variant, we don't know yet what that's going to do. What's the latest number on that? And do you have any information on transmissibility? We heard this week from SAGE that it could be 40% more transmissible than the previously dominant variant. So what is the Indian variant doing to your calculations?
Well, that figure, around 40% more transmissible, it is indeed, that's the latest advice I have. That means that it is more difficult, obviously, to manage this virus with the new Delta variant. But crucially, after 2 doses of vaccine, we are confident that you get the same protection as you did with the old variant. So the good news is that the vaccine still works just as effectively. Everybody must go and get their 2nd jab, though, because the first isn't quite as effective on its own. You need that 2nd jab. So ultimately, it does make the calculation more difficult for the 21st of June, but it doesn't change our strategy, which is we all need to go and get vaccinated, and that way we will break this link from the number of cases through to the number of hospitalisations.
It sounds like you buy the suggestion made by Chris Hobson, the head of NHS providers, yesterday, that the vaccine has actually broken the link between the virus and serious illness and hospitalisations and death. Are you confident about that now?
Well, I've said that that link is severed but not broken. It isn't completely broken, but we've made a massive, massive difference. The majority of people going into hospital with COVID now are unvaccinated. And that is, obviously that's a challenge for them, but it's good news for all of us because it shows that the vaccine protects you from going into hospital. Now, this week, we'll be opening up vaccines to the under 30s. And so we're getting a step closer to the point when we've been able to offer the vaccine to all adults in this country. And then once we've got everybody having had their 2nd dose, of course, then you'll get this protection that we're seeing at the moment amongst older people. You'll get that protection throughout the whole adult population. And that way, we can get out of this and restore our freedoms. But you know, the timing of exactly when we can take that step is the big question. We are not saying no to the 21st of June at this point. We'll keep watching the data for another week and critically watching that link from the number of cases to the number of people who end up in hospital. And it is absolutely true that the number of people ending up in hospital is broadly flat at the moment, whereas the number of cases is rising, showing that link is not absolute as it once was.
Secretary of State, I want to come to the point you raised about age in a moment, but let's just close off on June the 21st if we can. If the data demands a judgment call, because in the end, it's not the scientists who decide this, it's going to be you and the Prime Minister, Are you prepared for a modification of some kind, not lifting lockdown completely, but lifting most of the restrictions? For example, would you consider lifting lockdown but asking people to continue to work from home?
Well, we consider all options, and the way that we have set this out is as follows, that there are a series of things at the moment, restrictions on how you can live your life, that we have said will be part of step 4 when we can take step 4, which include, for instance, the rule of 6 and the fact that there's still some businesses that are closed. But then, as well as that, we have 4 reviews into international travel, into certification, and into social distancing, for instance. And we are concluding those reviews and doing that work at the same time. So of course, we're constantly looking.
Any of those things could be varied. Social distancing, for example.
Well, we haven't yet set out the approach to social distancing after step 4, and that is something that we're working on with our scientific advisors. But as you say, guided by the science, but ultimately it'll be ministers who make these decisions.
One of the things that we now know is that, all the oldsters, people like me, we've had our double jabs. Half the population's is fully jabbed now. Does that mean that we're heading now to a situation where you're going to want to jab all children and essentially make sure that before everybody gets back to school in September, all children have been inoculated?
Well, I'm delighted that the regulator, having looked very carefully at the data and with their typical rigour and independence, has come forward and said that the jab is safe and effective for those who are over the age of 12. So we're only talking about children over the age of 12 here. And we're taking advice currently from the Joint Committee on Vaccinations and Immunisations, the experts in this, on the right approach to putting that into practice. Now, of course, for the time being, as of today, we're vaccinating people aged 30 and over. Next week, we'll move to opening up vaccinations to the under 30s who are adults. So we've got a few weeks yet until we come out with a plan for exactly how and if we take this forward. But we know that the vaccine both protects you and helps stop you transmitting. And I want to protect education as much as anybody does. I'm the father of 3 school-aged children. And so making sure that we don't have those whole bubbles having to go home and the isolation, especially as we saw over the autumn, for instance, that has big upsides for education.
Are you detecting anything in the data that would give you cause to be concerned about spread of virus amongst young people and children?
No, and I think that it's very reassuring that the regulator has come forward to say that the vaccine is safe. That's in respect to the vaccine and young people. In terms of the impact of the virus on young people, it is very, very rare that young people are affected very negatively. There is some long COVID amongst children, and also crucially, they can pass it on. And that means that they have to isolate if they test positive, and then the whole bubble has to isolate, and you get all that disruption to education that we don't want to see.
So the aim of vaccinating children is essentially to protect older people. You're not worried about children.
So I'm so sorry, I missed that question.
The aim of extending the vaccination down the age range to children is more because you want to protect older people than because you're worried about spread amongst children.
Well, the spread amongst children does have an impact on others, and critically, we know how much it disrupts education as well. And then there is this the problem of long COVID in some children who test positive. So there's plenty of good reasons to do this, but we also will want to be very careful and make sure that we listen to the scientific advice on exactly what approach we take.
Are you listening to Tony Blair this morning? He suggested that we should be able to discriminate in favour of those who are fully vaccinated. Businesses should be able to give extra freedoms to those who can show that they are fully jabbed. Is that part of your plan?
Well, this is what the certification review is looking into, and that will report soon. The good news is we now have the technology available to do this, right? If you download the NHS app right now and you get yourself registered on it, then you will be able to see your vaccine status. You know, if I open my NHS app, it shows and can prove that I've had, in my case, one jab, and which jab and the date that you had it. And so we've got the technology in place. We know this is going to be needed because for international travel, some other countries have said that they're going to require this sort of proof. And so we're putting that in place. But in terms of using this domestically, we haven't gone there yet. We have this certification review, and we'll be publishing the results of that quite soon.
I do like the word "yet" there, Secretary of State. It sounds that you are actually open to the Blair advice.
Well, this debate has been going on for months, and we've been doing the work inside government, and we'll be coming out with our answers to that soon. When I say yet, the thing is that we know that this is going to be needed internationally because some other countries have said that it will, including, for instance, the EU. And so being able, you know, one of my jobs is to make sure you and everybody watching has the ability to prove that you've had the jabs, so that if, say, the EU bring this in, as they've said they will, then you'll be able to travel when it's safe to do so. Not yet, sadly, but when it's safe to do so. So we know that this is going to be needed internationally. On the domestic front, you know, that's a matter for Michael Gove.
OK, Secretary of State, what you've told me is the data, we're not sure, and so on and so forth. One of the reasons that we are uncertain is this Indian variant. And I wonder if you would accept that, frankly, you've only got yourself to blame for this. You put Pakistan on the red list at the beginning of April when the metrics were at a certain point. It then took you a further more than 2 weeks to put India on the red list, even though its metrics were worse than Pakistan. This is your fault, isn't it?
Well, the facts in your question were wrong. I've been through this many times, including on this programme with a couple of weeks ago. So the positivity of those coming in from India was a third what it was those coming from Pakistan. And at the dates that you mentioned, we didn't even know about the B1617.2 variant. And so you have to make these decisions on the data that you've got. You can't make decisions on the basis of data that you only find out afterwards because it obviously isn't available. So I'm afraid there are some people who were putting it about that India was in a... There are some people who were putting it about that India was in a worse state than Pakistan at that moment when we took that decision. But unfortunately, it isn't true.
That is not the question I asked. I'm reading your data here. Within days of Pakistan reaching 4.6% of positivity, you had Pakistan on the red list. It took you 2 weeks from knowing that India had a positivity rate of 5.1% to put India on the red list. Why?
No, I don't recognise those figures.
They're your numbers.
What I can tell you...
They're your numbers.
Well, what I can tell you is that as we saw the case rates rise in India, and as we saw this new variant, the now Delta variant, arriving, then we took the action to put India on the red list. And you know, it's tough action, but I'm very glad that we took it. In the same way that this last week we saw this potentially dangerous new variant in Portugal.
Nobody's going to contest that you made the right call, tough action, all the rest of it. It's just that it took you a long time, and longer than it could have done. And nobody's going to complain now, but I'm just saying, looking back now, would you accept that you could have done this days before the time when you did? And remember, during that period, it's estimated that something like 20,000 people arrived from India, when actually we could have had them on the red list?
Well, I'm grinning, Trevor, because I absolutely think hindsight is very helpful, and of course, during a pandemic,
why not say
you get more information. But you have to take decisions with the information that you have at the time, and you can't ask anybody to take decisions with information that isn't yet in your hands, even if you'd like to be able to predict the future.
I'm just reading the information you had at the time, but let's just deal with something that's happening this week. You want to support the developing world, and you want to use their stocks to vaccinate British children. Are you worried that we're going to, in a way, look like we don't care about the rest of the world because we're going to extend vaccination programme down the age range when actually, for example, in Africa, only 2.5% have been vaccinated? And we could be giving more stocks to African countries now.
I am going to answer this question, but first I'm afraid you can't get away with making a comment on my previous answer and then just moving on when the comment was wrong. You have to take information with the decisions with the information you have at the time, and the information that you've been talking about was not available to ministers at that time. So, that's why we took those decisions. We took the right decisions based on the information that we had. And of course, information came forward subsequently. Now, moving on to the other question, which is also very important. My first duty is to protect the UK population. And that does include trying to minimise transmission. And the way that we're helping the rest of the world is primarily with giving away at no cost the Oxford AstraZeneca vaccine. This was an agreement we came to over a year ago, and it means that of the 2 billion doses delivered around the world, 500 million of them are the Oxford AstraZeneca vaccine. 70% of the Oxford AstraZeneca vaccine doses are in low and middle income countries. I'm incredibly proud of this, and the reason that we've been able to do that is because we've made it available at cost, no charge for the intellectual property from the start. So I'm delighted now there is a global debate, including around the G7 table, about how we can do more to vaccinate the world, but this country has done more than any other by making sure that from the start that Oxford vaccine has been available at cost. And that's why within the COVAX programme, which is the programme that is designed to get vaccines to countries that can't afford them themselves, 96% of the doses are our Oxford AstraZeneca vaccine delivered at cost. So, absolutely, let's get this done. But we've been on this for over a year.
Yeah. Is this going to be associated with your big challenge this week, which is over the foreign aid budget? Are you going to count the value of those doses that you send to Africa as part of the foreign aid budget in order to drive up the percentage?
No. So the doses that are being made around the world, 20 different factories around the world, at no cost, that doesn't count as aid. It doesn't take aid to help the world. What we've done is we've invented a vaccine that's easy to transport, easy to administer, and we made an agreement with Oxford University and AstraZeneca over a year ago to deliver it at cost. So obviously the money we also put into COVAX counts as aid, but the really big contribution is getting this vaccine out to everyone as cheaply as we possibly can. Yeah. So it shows that you can help the world with far more things than just overseas development aid, and this is probably the biggest gift this country could give to the rest of the world, is to make a vaccine, to put in the money into the science, and then to make it available at cost.
I'm going to talk to Tom Tugendhat in a few minutes, Secretary of State. He is one of, it is estimated, 30 or 40 rebels on this foreign aid legislation. What can you offer him to persuade him to fall in line?
Well, I think that the decisions that the government's taken around this are entirely reasonable. We face a once-in-300-year economic interruption. The cost of that to the Exchequer has been hundreds of billions of pounds. So it is reasonable, absolutely reasonable in the circumstances. when we're delivering over £10 billion of aid as a country, and we're making available this vaccine at cost, and we have such a strong history in this area, it is absolutely reasonable to take the decision that the government has.
Secretary of State, I can't let you go without giving you the opportunity to reply to what has been said about you by a former senior advisor at Number 10. Dominic Cummings told MPs last week that you should have been fired at least 15 times for lying. You have said since then that you've always told the truth. There's no middle way here, no room for misunderstanding. Which one of you is lying?
Well, I told the House of Commons this. I responded in the House of Commons the week before last about these comments, and I was absolutely categorical about it. Obviously, I work incredibly closely with the Prime Minister, and I talk to him about all things to do with health, and in particularly COVID, all the time. I'm completely straight about what we know, what we don't know, the challenges we've got, and what we're trying to achieve. That's what I said to the House of Commons, and frankly, I think we should leave it there.
Cummings made it up, to be clear.
Well, all I can, I can't give you an insight into that. All I can tell you is what I know to be true, and that is that I've worked, every waking hour on this over the past year and a half, and I've been absolutely straightforward in answering questions, including where we don't know things, as we've in our discussion today. And whether in public or private, one of the challenges of a pandemic is you have to make decisions based on uncertainty. You have to be able to communicate that.